This advocacy is inspired by an article by Kasia Strek of The Guardian UK titled, "Pregnancy is not a disease. Why do so many women die giving birth in Nigeria?" I'd like to reiterate highlights of the writer's sentiments as they relate to that developmental issue called maternal mortality. First, let's examine the statistics that reflect what Nigerians are dealing with in terms of access to healthcare. Firstly, the WHO recommends one doctor to 600 people. Nigeria has one doctor to about 4,000 to 5,000 people. Secondly, the United Nations recommends 15% of the national budget for health. Nigeria allocated 5% to health in the 2024 budget. Thirdly, doctors continue to emigrate from Nigeria, making the manpower challenge in Nigeria a huge one. Now let's look at the maternal mortality rate in Nigeria. Maternal mortality in Nigeria remains one of the highest globally. A 2023 report from the World Health Organization, WHO, revealed that Nigeria accounted for 12% of global maternal deaths, stillbirths, and neonatal deaths. It is the second largest in the world. In the rural areas, 3 in every 5 women give birth with the assistance of unskilled childbirth attendants. The 2023 UN report on trends in maternal mortality from 2000 to 2020 revealed that a woman in Nigeria has a 1 in 19 lifetime risk of dying during pregnancy, childbirth, or postpartum, whereas in the most developed countries, the lifetime risk is 1 in 4,900. Nigerians have lost how many times? They've lost count of how many times the national grid has collapsed in recent times. Generators, which otherwise were substitutes, have become the main energy supply, but many generators are breaking down. And when they do, in hospitals, the consequences are fatal. If it is during an important surgery, the woman may develop complications in those critical minutes or even die. Now, everyone is flocking to solar, but it is so expensive for hospitals to install. I know the Nigerian government is doing something with the restructuring of discos, but while that is ongoing, what is the proactive step being taken by the Ministry for Health to prevent an escalation in maternal mortality in this dark season of perpetual blackouts?